Good evening, ladies. I'm not for sure if this is where we had left off on GI, but we're going to start with peptic ulcer disease. As you can see there, the definition is it's an ulceration, so it's some sort of breakdown. You can see here's an actual picture of one in the stomach, where now this layer of your stomach can handle acid. It's resistant to it, but once that layer gets broken down, this inside here cannot, and that's what causes that pain. It ends up causing the bleeding. Now, the big thing to know is what is the primary cause of peptic ulcer disease? It's actually bacterial with H. pylori, with 80% of the cases here being of causes of peptic ulcer disease. The other 20% happen from NSAID use, which again are non-steroidal anti-inflammatory drugs, which do the same thing. They have a side effect of GI bleed, and so again they're going to put you at higher risk for this. So how do we take care of it? Number one, there's nothing you can do about an infection other than treat it. So to treat the infection, we have to give antibiotics. We need to remove the H. pylori. So we're going to use this thing called triple therapy. That's actually 2 antibiotics and antacid. When we do the antacid, it's not going to actually treat it, but it's to help decrease some of the symptoms. We're going to decrease the amount of acid in there and let that ulcer heal. The other thing we might do too is we might encourage them to avoid high acidic foods as seen here, and we're going to want any foods that cause dyspepsia to be avoided. All right, dumping syndrome. This is very important to understand. We talked about the opposite of that, gastroparesis. So this is dumping syndrome. This is one thing I remember, the stomach is the one who controls how fast food goes into the small intestine. And so dumping syndrome is just like it sounds, where the stomach just dumps all of its content into the small intestine instead of slowly having it go in. So all or part of the stomach is removed. Can be a cause. Having the pyloric sphincter removed are really the big causes of this. And so what could be the reason for that? Maybe they have stomach cancer, for example, or they had bariatric stomach stapling or part of their stomach removed because of that. In any of those cases, the food is going to be dumped rapidly into the small intestine. Here you can see, you can review right here what are the signs and symptoms of early and late dumping syndrome. So how do we help them with nutrition therapy? Well, first of all, we definitely do not want them to drink liquids with the food. We instead want to do it in between to help decrease how fast food is going through. So if you drink fluids with your food, it's going to go through your stomach quicker. Therefore, we're going to avoid simple carbohydrates or simple CHOs because those don't need to be broken down at all. Like if I just ate some table sugar, that doesn't need to be broken down. It's going to go right from my stomach into the small intestine. Whereas something like wheat bread or a piece of chicken or maybe some butter on that bread is going to slow the ability of the stomach to dump that right in there. So we're going to avoid simple sugars. We're going to instead eat things like protein, fat, complex carbs. The other thing we're going to actually do is we're going to have them lie down for 15 to 30 minutes after a meal to try to take gravity out of the effect. You can see now what will we do though if the person has dumping syndrome and they have GERD? Well, we try to do the best of both worlds and we'll actually have them go at a 45-degree angle. All right, so here is bariatric surgery. So as you can see here, this is one of the big things that can cause dumping syndrome. Over here is a picture of the 3 different common kinds, where here you can see this is actually a band. This is where a large part of the stomach is actually, it stays in the stomach, but it's rerouted, whereas this one is actually a whole big pouch is removed. So what's going to happen here is, no matter what happens, the stomach has become much smaller. With the banding, that stomach is now can only hold about 15 to 30 milliliters at a time. Let's see. Surgery is not going to be a magic cure-all, but it's going to be a tool that works best with diet and lifestyle changes. And the other thing too is surgery is going to require that there's some dynamic changes need to be made in intake. So if, for example, with the gastric bypass, it reduces the storage capacity of the stomach to 5%, so a 95% reduction. If I try to eat the way I've been eating, it's not going to be good consequences. I'm going to be very sick to the stomach and most likely be doing lots of vomiting. So nutrition therapy is very important pre-surgery, post-surgery, and for long-term weight management and overall health. So what are we going to do before surgery? So first of all, pre-surgery, we're going to put them on what's called a VLCD, a very low-calorie diet. Um, they need to be on this usually for 2 weeks, and it's going to be low carb. It's going to be protein shakes and low-calorie beverages. It may be allowed small portions of lean meat and vegetables. And actually, there's some research out there that shows that a weight loss of 10% pre-surgery reduces the liver size, which can then shorten the surgery time and may prevent surgery complications. These patients should already have been screened for problematic eating behaviors, which would be a barrier to post-surgical success. For example, if this patient is a binge eater, if they are an emotional eater, or even eats for boredom, they're going to have a lot of psychological stress post-surgery when that's not possible. Post-surgery, you're going to see the goal is to meet the macro and micronutrient needs while creating a substantial calorie deficit. They're going to be on a clear liquid diet for 24 hours after surgery. Then we're going to add the protein shakes at about 48 hours post-op. Then we're going to go from pureed and then into soft foods. They're going to have to eat small, frequent meals because, again, that stomach can only have a very small amount. We need to make sure that our patients are thoroughly educated about chewing their food thoroughly to avoid fluids 30 minutes before and after eating because, again, we need to they're at high risk for dumping syndrome. It's the exact same thing here. We need them to eat slow and to stop when they start to feel full. Another thing we want them to do is actually begin their meal with a protein. And we want them to still get in 5 or more servings of fruits and vegetables to get that fiber and the phytochemicals they need. We want them to avoid concentrated sweets. So think back to yourself, what are some concentrated sweets or empty calories that's going to exacerbate dumping syndrome, those simple sugars. And we're most likely going to be putting them on a multivitamin, and we're going to be wanting them to drink at least 1.5 liters of fluid a day. In the critically ill patient, they may actually need to be put on TPN, total parenteral nutrition, to meet their nutritional needs because the stomach is just not going to be able to hold the contents it needs. And just to think about how severely a restriction this is, at 2 months post-op, their total meal at each meal is 1 cup of food. So we talked about that earlier with diabetes, and so we just did 1 cup of pasta as 1 part. That would be all they would be consuming for the entire meal. That pouch is just much smaller and can only tolerate so much. Again, I talked about it can cause vomiting if they eat too much. This patient is also going to be at risk for gout and gallstone because of due to the very low calorie diet, and then also because they're going to have rapid weight loss. Here you can see this is something you can do on your own, and you complete this. If you have any questions about the answers, I'm more than willing to go through it. All right, celiac disease. So this is going to be a chronic autoimmune disorder. The big thing here is what do they need to avoid? So as you can see here, they need to avoid gluten. So very important. What is gluten? So it's an incomplete protein, and where is it found? So it's in foods that have wheat, rye, barley, oats. So you need to now know what are those foods, because if you just tell I need to avoid rye or barley, I might not associate that with certain foods, and so you need to make sure that they understand that. Make sure you review in your book what are good food sources, what are food sources to avoid, especially with wheat because it can be hidden. So make sure you review what is actually has gluten in it. You can see here what the classic signs and symptoms of celiac disease looks like. So the key here is we're going to have to remove gluten from the diet for the rest of their life. Here it is actually, here's the table I was thinking of, table 17.3. You're going to want to review that because things can be, especially wheat can be, it doesn't necessarily just say wheat right on there, it can be more kind of a hidden source. This next picture right here is showing you lots of different things. What in here is gluten-free? So go ahead and pause the video and look through this and write down what do you think is gluten-free and what isn't. All right, now after you've done pausing it, here is actually what is gluten-free. The pop chips, the rice, potatoes, legumes, nuts, seeds, and corn. French fries may contain gluten, so it all depends on how they are prepared. All right, go ahead and stop the video and answer this question. Here is the answer. All right, lactose intolerance. Now, we've talked about this before, so this shouldn't be brand new to you. The main thing we're going to review again is the nutrition therapy. So doing things like consuming it without, or excuse me, consuming it with other foods can actually help increase the tolerance of lactose-rich foods. As you can see, most people, even who are lactose intolerant, can take about 6 to 9 grams of lactose at any time. That's about 4 to 6 ounces of milk. Other sources of dairy that we could do is chocolate milk is going to be better tolerated, and so is yogurt. Frozen yogurt has even less lactose in it, so you can, that's even another way to not completely avoid this food group. Because the people who have lactose intolerant are going to be at risk for greater risk for 3 deficiencies, and they are calcium, riboflavin, and vitamin D. This patient needs to be taught how to read a food label to make sure they're avoiding things that would exacerbate. Inflammatory bowel disease, there's 2 kinds. There's chronic ulcerative colitis and there's Crohn's disease. We put them together because they both have the nice classic signs and symptoms of this profuse bloody diarrhea. This disease process is very important to review because they're going to be at very high risk for malnutrition, and the reason why is because they have decreased intake. If you are having profuse bloody diarrhea, are you going to want to consume a lot of food? The food that you are consuming is going to be malabsorbed. Look at what the inside of the GI tract looks like. How is that going to be a very good job of digesting here? So they're going to have increased nutrient loss, and actually they're in a hypermetabolic state, so they have an increased nutrient need, because they use more. With ulcerative colitis, that's the first kind of inflammatory bowel disease. That one can possibly be cured with surgery. However, Crohn's disease, we rarely do it because it actually usually just it comes back, and now they just have a shorter bowel as well. We do both of them are nutritionally treated the same way. We need to replace those nutrients lost. When they're having that acute episode of profuse bloody diarrhea, we want to rest the bowel and put them on a low fiber diet. Once that is gone, we can then, they're in remission, we're going to want them to be on a high fiber diet. That's going to help increase the stools so they're not so they don't have quite as much diarrhea. They're going to be at high risk for malnutrition. So what kind of diet are we going to put them on? It's going to be high calorie and high protein. And we're going to want them to do small, more frequent meals. Ileostomies and colostomies. All right, so you can read this slide on your own, but let's think about it this way. So Richard recently had an ileostomy after resection of part of his colon due to cancer. He's having a difficult time with the distended bag and its foul-smelling contents. What can he do about this problem? Go ahead and stop this video and think about that for a second. All right, so things you hopefully came up with is that maybe some of the foods he's consuming are gas-producing, such as apple, beans, broccoli, cabbage, cauliflower, corn, onions, peas, peppers, carbonated beverages, etc. There are foods that may cause more foul smells in the waste, like corn and dried beans, onions, cabbage, and very spicy foods. Then there's also actually some foods that may help control the odor and gas, which actually are buttermilk, parsley, yogurt, and cranberry juice. And he also may be able to reduce the amount of gas by avoiding chewing gum, drinking straws, carbonated beverages, smoking, and chewing tobacco. All those increase the amount of air that you swallow. Lastly, he should really make sure he's eating slowly, and chewing the food thoroughly may also help. Make sure you really understand the difference between these two and the recommendations, and how someone who has had an ileostomy, since their stool is going to be liquid, they're going to be at a greater risk for fluid and electrolyte loss. All right, diverticular disease. So you can see here, this is a chronic disease usually seen in the older adults. The bowel is weakened, and they get these pouch-like herniations, and they protrude. What is the cause here? A low-fiber diet, increased pressure from straining. So what are we going to do? During inflammation, we're going to rest the bowel, put them on NPO. But we're going to put them on progressive meals, and we're going to want them, once it's resolved, to go back onto a high-fiber food and high-fluid diet. Here, as you can see right here, are a high-residue, high-fiber diet. It's also going to be used for constipation. You can review this on your own and include seeing this box 17 for what am I trying to say? Fiber-rich foods.